Hello, everyone. This is your host, Dr. Tomi Mitchell from the Mental Health and Wellness Show. Today, I have the pleasure of introducing Dr. Erin Hurley. She is a board certified physician turned well being and performance coach who specializes in empowering healthcare professionals, physicians, PAs, NPs, therapists, and more to overcome burnout and build sustainable, fulfilling careers. As the founder of the Happy, Healthy Healer, also known as Transformational Doc, she uses a science backed coaching framework to help her peers cultivate balance, boundaries, and joy both at work and at home. Leveraging firsthand experience in clinical practice and leadership, Dr. Hurley understands the systemic pressures and personal stressors that plagues today's healthcare workforce. She's known for running dynamic workshops like Break Up with Pajama Charting that saves clinicians hours of after hours work and leading retreats focused on energy, movement, and rejuvenation. As a best-selling guest on shows like Lead and Lift, she shares practical tools, pausing to engage executive function, breaking goals into bite-sized steps, and delegating effectively for sustainability. Without further ado, I would like to reintroduce our guest, Dr. Erin. Welcome to the show.
It's so nice to be here. Thanks for having me.
Thank you so much for being here as well. I always like to give my guests an opportunity to really share with our listeners a bit about them so they can really get a feel for your heart as we have this conversation on wellness and burnout.
Well, a couple of unique things with me. I actually began working with a coach back in 2017. So before much of the research was even out about the benefits of coaching in medicine. And I'm so grateful that you and I shared about us both being coaches. And that really helped open my eyes that I could have the same career, the same family, the same situation, and have a much different outcome when I chose differently. Because I worked in child abuse medicine for 10 years and was the medical director of a nonprofit child abuse center. As the world moved through the pandemic and everyone experienced a big dose of trauma, I realized that I was very well prepared to deal with trauma. My husband's a firefighter medic. We both had a lot of trauma in our careers and had a lot of skill sets in dealing with it. And I realized that we were uniquely prepared to deal with that, and not many are. So I love being able to bring that not only when I was practicing medicine, I've since retired in my child abuse medical practice, but also to the clients that I serve and being able to walk alongside them through some of the most traumatizing times of their lives.
Well, thank you for sharing that. And you know what? I'm so glad that, you mentioned your husband is a firefighter, a first responder. That is one of the fields where we see a lot of post-traumatic stressors, right? They see a lot, especially if you're in the career for, you know, 2, 3 decades, you see a lot. And that's not always the case. Not everyone is able to move through it in a healthy manner, but that's really powerful that you and your husband were able to do that. And also the work you did for, decades in child abuse, that takes a lot of courage and grit. And having a system to unload in a healthy manner when you leave the workplace and go home, because there are things that you don't ever want to see or imagine that it's happening, but it's a reality. Then you mentioned before we started recording, you're a pediatrician, right? So
Correct.
I know you love kids. You can't be a pediatrician without loving kids. I love kids. And then there's a mom, I'm a mama bear. Even before I became kids, my patients were my babies. And the thought that them being hurt or anybody being hurt, it just drove me crazy. It's troublesome. And I think you're well suited to do the work you do because you've lived it. And that's shows authenticity. That shows that you're just not just talking, you've actually had to walk the walk. And I think that's what makes really powerful coaches and really powerful physicians who are in this field because they have the receipts.
Yeah, and it also gave me a unique ability because I had to learn to be neutral.
Yeah.
If I was asking a child, I didn't know what had happened, and asking them for their reality, it wasn't my job to believe or disbelieve. My job was to listen to them from a neutral
Yeah.
manner. They had to know that I could handle anything they had to say, or they weren't going to
Yeah.
continue sharing. And the gifts that those 10 years in child abuse medicine gave me to be able to be fully present for my coaching clients, to be able to listen to whatever story they bring me and not get emotional if it's not appropriate, not to get thrown off my A game,
Yeah.
but be able to really dig into those messy places of their lives. It was really a gift to me. And I learned and grew so much, even as I've listened to some of your earlier podcasts, one of your guests talking about energy medicine. And I know from my perspective, I was very traditionally allopathic medicine trained. And
Yes.
those 10 years in child abuse medicine helped me kind of take off some of the blinders, be more open to what some people might call woo woo medicine. I'm putting
Yes,
in
I
air
hear
quotes.
you.
And, the energy we bring. And I've now learned to trust my gut instincts, to
Hmm.
listen. Is this a great fit for me as a client? Is this a great place for me to work? Is this worth my efforts? Or do I need to kind of disengage because it's not the right fit? And I think we oftentimes really separate ourselves from that. We're so in our brains as
Yeah.
physicians, and then we forget about what it's like to be in our bodies, pay attention to our bodies and our hearts. And I have so appreciated my ability to rekindle my relationship with my heart and my body and my energy, much different than my first 2 decades in medicine. And my coach was such a great match for me. She was actually, I think, had previously been a counselor. She was a high performance coach. She had many medical people in her family, and she was a death doula and had done work with shaman and energy.
Hmm.
What an amazing gift for me to be able to work with her to kind of get me out of the ruts that I was stuck in, and then help demonstrate to me, role model to me, how I can help others do the same.
Yeah, that's beautiful. When you spoke about finally being present within one's body versus this traditional Western medicine that we were trained, because I remember when we're dealing with trauma or mental health, it was more like this checkbox. It was more like just waiting to hear that word, that key phrase, not really connecting and being present and listening. And it wasn't until like myself, I had to pause, go through burnout, find a coach, and really learn about myself, was I able to really reconnect. And it just changed the way I saw life, the way I interacted with my patients and even my coaching clients afterwards. But for many people who are still on the fence about all this coaching, gut and intuition stuff, and like you said, they think it's woo 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 woo. I did at one point, especially when you talk about yoga or all this other stuff. Like, what is that? Like, I was too busy. I didn't have time to sit still or think about nothing. Like, that didn't make any sense to me. But now I'm a believer, right? I think for many of us, there's that breaking point with that shift in our lives where you went from practicing medicine in a traditional route to actually what I feel healing, helping heal and transform. Do you mind sharing with our listeners if that point in your life where you were like, okay, one day you're sipping the Kool-Aid of Western medicine, and then you slowly, I guess, your eyes opened. You had that come to Jesus moment or whatever you want to call it. Do you remember when that time was in your life?
I think it was gradual. Again, spending 10 years in child abuse medicine, it was listening to other people. We were in a multidisciplinary team. And
Yeah.
so the healthcare provider worked with the interviewer. We had an interviewer who was a mental health therapist. We started a mental health program at our center. We worked with somebody who was the family support specialist. So they were there to support the parents while we were supporting the child. We worked with child services, the DA's office, the law
Mm.
enforcement, and other healthcare providers. So it really helped me not just be kind of stuck in this, I'm putting my fingers in this tiny little box of
Box.
medicine, thinking like
Yeah.
medicine. And I was a supervisor, so I had to develop deep relationships with my staff. And I remember interacting with one of the interviewers, and she was very good about boundaries. This was before my coach. I didn't respect boundaries at all. I thought they were a weakness. And then as I developed, I worked with my coach, and I realized how terrible as physicians and healthcare providers were about setting boundaries, and
Yes.
that it was causing negative repercussions, not just for us, but for our entire teams. And I said, hey, can you help me help my providers learn better boundaries? And now
Mhm.
I embrace boundaries instead of shunning them or thinking that they are a weakness. And I really think that working with individuals outside of medicine. So, in addition to working at the Child Abuse Center, a few years later, I started working with my coach, getting into personal development and going to personal development conferences, getting into masterminds. And I started learning from a lot of people outside of medicine. They were entrepreneurs and
Hmm.
authors and worked in fitness and worked in mental health. And so I was go, oh, these people have a
Hmm.
much different way of thinking and doing their careers than we do in medicine. And so it really kind of broke open that small box I was used to problem solving and thinking in medicine, and really helped me be much more open to other ways of thinking and doing medicine. And now I get much more curious instead of judgmental about, oh,
Yes.
that's just snake oil. That's not going to work. And I get
Yes.
curious and I say, I wonder if that could. And then I try it out. Then you experience it, just like with coaching. If you've never tried working with a coach and you do a session or two and you're like, oh, that's what people are talking about.
Hmm.
So getting curious.
I love that. Curious. And it took time. Like it's a transformational process, right? It's not like one day you're here and one day you're not. It takes openness and getting outside that medical box. I don't know about you, but I never heard of before. Not that long ago, I didn't really hear of coaching. Like you heard about life coaching, but the stuff that we're doing, I just didn't. You didn't hear about it in training. I didn't hear about it in residency. I didn't hear about it probably in my first 8 years of practice.
Well, I started practicing in 1997, so a little bit of an age difference here, I think.
Yes.
And it was 20 years into my career, and someone online who promised 30% more productivity with their a free download. And I thought, oh my gosh, I could use 30% more productivity in my
Hmm.
day. And I downloaded it, and then I got a call weeks later after I'd bought their book, and they offered coaching. And I had no idea what I was going to get out of it, but it actually came out of a pity party for my 50th birthday. So I was 20 years into medicine, having a pity party. I was home working on my birthday and sick. And that was
Uh,
before the pandemic. We didn't know how to do working from home. And I was just miserable. And I thought, you know what? I'm going to celebrate my birthday all year long. And so
yeah.
several weeks later, I got the call, and it was a whole lot of money. And I had no idea, but they made this promise of, going from feeling caged to feeling charged. The language I use is going from victim mode, which I was certainly in victim mode, oh, poor me,
Mm-hmm.
to empowered mode. And there's a line in the sand in my life before coaching to after. And I never want to go back. I can totally recognize where I was at before and go, not going to happen again. Very eye opening experience for me.
100%. I definitely don't want to go back again. Now, earlier you mentioned as healthcare professionals, we often struggle with boundaries. How does this show up in the lives of the people that you've come in contact with? Like, give us examples of these boundaries that we tend to violate as
Mhm.
busy professionals.
Yes. Well, again, before I started working with my coach, and you said years ago you weren't hearing about it, people still aren't hearing about it.
Yeah, that's
I'm the only
true.
coach in my area. It is not part of the normal system. Some of the big systems
Mm,
have embraced them, and yet there's studies out there. Burnout is at the highest rates, and coaching has been shown to decrease burnout and improve
mhm,
well-being, and yet
mhm.
it's not being used as a regular part of wellness programs. And so to me, that I get a little fired up about it.
Exactly.
And again, I didn't learn about boundaries, as you were asking about, until I started working with a coach.
Right.
And the way a lack of boundaries shows up is we're oftentimes people pleasers.
Hmm.
We are in a caring profession, so
Yes.
everyone comes
Yes.
before we do. So we're the last on our list of people to care for.
Yes.
If something comes off your plate, then something immediately fills it back up.
Yes.
And so instead of, you found an extra 2 hours in your week and now you say yes to something else. And if we say no, then we feel guilty about it,
Hmm.
and guilt isn't serving anyone. So it's just a different, I mean, coaching is very much about changing our mindset. And when we think, if I don't say yes, they're not going to like me, I'm
Mm,
not going to be, well, I have to say yes, everyone else is doing this. And for myself, when I was working at the child abuse center, it took a lot out of me. And, yes, there was volunteerism at my kids' schools. I have 3 kids. And yet I said to myself, the boundary I set was, I am volunteering. I am giving of my service and time that not everybody can do. Not everybody can do child abuse medicine. That's my gift to my community. And because I'm doing it in that manner, that means I'm going to have to say no to being on the PTA, being the
yeah.
volunteer for my kids' orchestra. And I was okay with it. I didn't allow myself to feel guilty that I
Yes.
wasn't doing what all the other moms were doing, because they weren't doing what I was doing either. And I was okay with that. And I said, this is not my season. And maybe I will be able to do those other roles. Not having boundaries because we really need to pay attention to what is this season in our life? How old are my
Mm.
kids? What are my other duties? And too often times we just say yes and we don't pay any attention to this is not the right season in my life to do this thing. If there's time later, I'll do it, but just saying no now.
Yeah, wow, that's so interesting. You mentioned the whole kids and the, meetings and things. Like my daughter recently asked me this week, Mom, you should volunteer in one of our field trips for school. You need to, Mom. And I'm thinking to myself, yes, that sounds great. But mommy has a lot of other responsibilities that a lot of other mommies don't. Like I mentioned before we started recording, I just recently accepted a position as a medical director in an eating disorder clinic, and I still have a clinical practice. And I'm thinking to myself, I don't think most mommies have to deal with young adolescents who are severely malnourished or struggling in multiple ways. You know what I mean? Like it's not the same, but giving ourselves grace and not feeling guilt and not saying yes to everything. There's a season for
Mm.
everything, and right now, perhaps that's not my season. There's other ways I
Yeah.
can shine and be there
Well,
for
and
my
the other piece too is so I think my husband helped me learn this is that even if we're the best one for the job, if you're the best one to be the medical director, the best one to run your organization, sometimes it's still okay to say no and to let somebody else step in. He talked
mom.
about if you put your hand in a bucket of water. So I remember I was a leader, I was
Yeah.
considering stepping down. What is this costing me? And he says, if you take your hand out of a bucket of water, what happens? The water fills in.
Hmm.
So if you don't take up that space with your hand,
Something
somebody
else will.
else's hand will go in.
Yeah.
So, and if we're always the first one, we're always the best, we think we're the
Mm.
best. Well, you might be, but it just may not be. And so the other thing I would say as a coach is saying, I usually sent my husband on the different field trips with my kids. And I wish I would have said no to work more often and created more space to attend with them because he was usually the one attending with the other moms. And I missed out or I was oftentimes late because
Mm.
I said yes too much to the office and not enough yeses to my family.
That's a common guilt that many of us have felt, or some feel their entire career. And it's unfortunate because those precious moments are important. We'll do our best to attend some, but not all. We just can't. We got to give ourselves the grace. And you know what? I think it's really hard as women to do our jobs because, we are in fields that were once male dominated and still largely are, especially leadership roles. And then if you choose to have children or able to have children, there's that role too. And it's like they almost don't mesh well. Like you're expected to be this not stay-at-home mom, but pretty much like have everything else in place. You know what I mean? And you're still working, bringing value to the family, bringing resources that if you didn't have that position, your kids may not have been able to enjoy. Do you know what I mean? But it's hard.
The odds are stacked against us.
Yeah,
And if you're okay
highly.
with it, I'll share some of the
Yeah.
stats that I share with women that I coach. Women physicians, especially if you're not married to another physician, we have 1.5 times the divorce rate.
Oh yeah.
As men physicians for the same age,
Mm-hmm.
we take 1.5 times longer in the electronic health record.
Mm-hmm.
And we, let's see, we spend, I think it used to be 3.5, and I think now it's closer to 2.5 minutes longer in the exam rooms. We still have more responsibilities with childcare and our household than our spouses do, even when we're physicians.
Yep.
And so that adds up to a lot of extra work and hours.
Mm-hmm.
And, what's the benefit? We get, the research says, better outcomes with our patients.
Yes, that's
And yet I say, at what cost?
exactly. Our families, our relationships, our
Yeah.
everything else.
I don't have any great answers, but I think it's important for women, especially as I see them struggling because they want to be a great mom, they want to be a great
Mm-hmm.
physician, and yet they have trouble setting boundaries or carving time out for themselves. And then they're just running on empty all the time. And as you said, medicine started out male dominated, at least in the US and in Canada, where
Oh
you're
yeah.
at. And so the men are struggling. And some of the research I've done just looking at how we do medicine. So I use this visual of in the US we oftentimes will have turkey for Thanksgiving
Oh
and
yeah. Same here.
holidays, enormous platter, right, for the turkey
Mm-hmm.
to go on. It might serve 18 or 20 people.
Mm-hmm.
And so if you think about your one person serving plate, is instead of a normal dinner plate is the size of a turkey platter as a
Yeah.
physician, as a mom,
Yeah.
as a parent. And then it's just piled high to the ceiling. So you've just got stuff falling off that plate. It's hard to manage it all.
Oh yeah.
These days, if you look at how we do the medicine, like we just dive in and we just attack it, but there's not any method to the madness. And as I've looked at the research on what happens if you can have 60 to 90 minutes of uninterrupted time to get your work done, you can
Mm.
get into flow state and
Hmm.
work up to 5 times faster.
Oh
How
yeah.
many physicians ever get an hour to an hour and a half of uninterrupted time? Every time you get interrupted, it can cost you up to 25 minutes to get
Hmm.
back in that workflow. How
Hmm.
many times do you get interrupted every day and what happens? So I try to encourage people to use this research based information and get more done using less time and energy so that as a mom, as a spouse, as a
Hmm.
person running your household, when you get home at the end of the day, you're not completely depleted because you've learned ways to improve your workflow, to use your time differently, and to get more done with less time and energy. There's not things wrong with corporate medicine. There definitely
Oh yeah.
is. And yet we do have more control than we think. And I've helped people save 15 to 20 hours a week just by teaching them some of these strategies if they are on kind of the far end of the spectrum of really taking a lot of work home, just because I'm sharing with them the research based methods that help them get it done more efficiently and effectively. And it's not rocket science, but they don't teach us how to do that in medical
Oh, they
school,
don't
nor
teach
is
us
it
anything.
we are so outdated. Not only, I say that if if we practiced medicine the way we do our workflow in medicine, which is completely not research based, we'd be getting sued every other day. Our patients would have terrible outcomes. And yet we need to invest in learning how to do the workflow of medicine better, more science based
Yes.
than sporadic, haphazard, chaotic is not working.
Yeah, I think this is a really good conversation because, and we even for another conversation, because in residency, we were trained by physicians who were in a teaching facility. So they'll spend an hour per patient, or a busy day with six patients or five patients in the whole day. I don't know about you, sis, but in private practice, that doesn't work. Like those of us who are fee for service, so you're almost set up for failure. You
Yeah.
can't see six patients in
Yeah.
a day.
Yeah, I have a term for that. My residency training in Portland, Oregon was OHSU, and it was literally on the hill. And
Yeah,
so when you didn't practice medicine on the hill, you kind
yeah.
of, I referred to it as, well, there's on the hill medicine, and then there's medicine in the real life.
In the
And
real
it
life,
is not, it's not the same.
you are
Yeah.
expected to have the notes and everything
Mhm.
like practicing on the hill, but you're in the trenches.
And it's gotten so much worse. I remember when I got out in practice, my first practice had paper charts. So I'm
Oh, I
dating
had that
myself.
too.
And the notes were literally 4 to 6 lines long. Subjective was one line, objective was one line. It was, I can still visualize one of my colleagues' notes about strep throat. It was so brief and it took him maybe 2 minutes to document.
Hmm.
And now everything in the EHR, granted, there are benefits to the EHRs. And then the other half is at what cost and what collateral
Oh
damage is
my
it
gosh.
creating because of all the workload to try to get everything
Yes,
implemented in there.
something so
So,
simple is
yeah.
suddenly like this thesis statement. Like
Correct. And how do you even find the meat of the note in all of that
too much
paperwork?
fluff.
Yeah.
I
So
know.
yeah, it's so I don't think medicine is made for men anymore either. And
No,
it certainly isn't made for women. And we are using very outdated norms. And we can see it in our burnout rates. Some
100%.
people are saying, oh, well, the burnout rates are trending downward. I'm like, trending downward from 55% to 45%. That's still half the people were either burned out last year or they're burned out now, or they were burned out both years. That is not
Or they left
acceptable.
the group entirely, so they're no
Or
longer included in
yeah,
that.
left medicine,
Uh,
or they left, due to suicide, right? And that's
exactly.
something that I oftentimes talk about. I'm thankful that I have not had issues with suicidal thoughts. And yet I see how dangerous it is for women
Hmm.
surgeons and women
Hmm.
physicians. And to me, this is not an acceptable side
Mm-mm.
effect of
No,
practicing medicine. And so we do need to update how we're practicing and the methodologies in our workflow in order to better meet not just the patient's needs and to keep the quality of medicine high, but to make it so that those providing the healthcare can have a sustainable career.
100%. In Canada during the pandemic, they did a survey on burnout and they put the biggest risk factors for burnout, okay, of women, okay, certain fields like high caring fields, high trauma fields, including our oncology, I think primary care and ER.
Yeah.
Other things were being a caregiver. So whether it's a young child or an older, like an elderly parent that's a caregiver, visible minorities,
Mhm.
or disability, like those just amplifies your risk, which leads to like the next conversation is, hidden traumas, hidden pains, because not all disabilities are visible, right?
Mhm.
Not all pain is visible. And I think when you look quote unquote normal, but inside you're literally dying and torn apart, it's hard for people to say, oh, this person's not doing okay, or this person's doing okay, right? It's almost like you have to prove yourself. So in a field where you're expected to be on 24/7, I used to pride myself on how long I went without using the bathroom. You know what I mean? Or how little sleep I got during residency. Like it was terrible, especially
And
OBGYN.
you probably showed up with a smile on your face,
Oh,
right? I
yeah,
look at it as we show up with this facade
exactly.
because I'm a physician. I have to be perfect. Nobody can see that there's a chink in my armor. Nobody
Mm-mm.
can see that I'm not showing up at my best. Medicine is exhausting enough, and then you got to show up fake. You can't be a real
Hmm.
person. And I'm
Oh,
not saying that you need to share everything with your patients
yeah.
or colleagues, but I'm just saying that we are not robots.
Mm.
And yet, oftentimes, we're treated as if we should be robots.
100%.
And I just heard a surgeon give a talk last week, and she talked about the trauma from using the bathroom outside of her office because she had a miscarriage in
Mm.
that bathroom and went straight to the OR and didn't let anybody know about it. Or somebody who hears about the death of their parent and then they walk into their next patient.
And that's
I
happened.
know,
Both
yeah,
of those have happened to me.
yeah.
Both
And
of
it's,
those.
I remember,
Grandparents, but and
yeah.
miscarriage. Yeah.
Yeah, earlier in my career, my husband is a firefighter, and we lived in a very small town, and there was a big fire. I called him, and he was off that day. He came into the fire, and we had three fatalities from
Mm.
that of firemen in that, and I didn't know if my husband was one of them. And at least at that point, it was near the end of the day, and I just said, I can't see any patients right now. Like my brain is checked out.
Mm.
I need to find out what's going on.
Mm.
And luckily, it was not him, but we lost three of our friends. And I'm grateful, but I also remember having a miscarriage and thinking about, oh, I'm on call this weekend. How am I going to deal with this
Mm.
and deal with this miscarriage? And luckily, it was just they couldn't find my baby, and he's now 19. So that was, but that was the worry about
Mm.
that was, oh my gosh, what am I going to do? I'm on call. We need to treat ourselves as humans, and the system should be treating us more as human beings.
That is true, because sometimes even if you want to treat yourself as a human, the system that you work on dehumanizes you because there's no grace for being human. There's no
And your
grace.
role models,
Yeah.
who are your role models?
Mhm.
And even for myself, putting in long hours, I didn't have other physicians in my family, but my mom and my sisters worked really long hours just like I did. So I was looking for role models, and there weren't
There
any
weren't
to
healthy roles.
show it's okay to go on a walk at lunch. It's okay to get off your screen. It's okay to take care of yourself. They were few and far between. So I love working with individuals in medicine, but I also, as the medical director, I changed the culture there, and it became normal after we saw our morning evaluation. We would go on a walk. We had a facility dog. We would go on a walk out around the neighborhood, a group of us, whoever would come along. And that became the norm instead of being chained to your desk all day because, sure, we had charts to do, sure, we had work to do, but that 10, 15-minute walk allowed us to come back and be more fully present and
Mhm.
be on our A game that
Yeah,
afternoon rather than plowing through and not taking that break.
exactly. Just living off Dunkin' Donuts and coffee,
Yeah. I
right?
call it, yeah, adrenaline and
But,
caffeine, which
yeah,
not
exactly.
good, not
Yeah,
good.
no, but many of us did it. But that is beautiful, and it's possible, like you said, to change culture. It takes some willingness. It may seem small, but that 10 minutes is profound. And the ripple effect of the change in energy when you're dealing with patients, stakeholders, other people, it just brings a more positive atmosphere conducive to healing for everyone, including the healers. Because I really feel at the end of the day, physicians, healthcare providers, we really have to work on healing ourselves and healing our broken systems because the systems that we work in, many of us work in, that were never healthy to start off with. Like, I don't remember anyone telling me about wellness or sleeping properly. They just said, get up and study. You got exams. You know, it's like, get up, read. There was no balance. No one talked about balance. No,
Yeah.
nobody talked about self-care.
Yeah.
I don't remember. Maybe they did, but I don't
Yeah,
remember.
no, they didn't. I don't think they did. And I can imagine your listener, like when I'm saying, oh, we went on a 15-minute walk, saying, oh, well, I can't do that. There's no way I can fit that into my routine. Saying that wouldn't fit my practice style.
Yeah.
And yet you can close your eyes for 30 seconds. You can do a mini meditation while you wash your hands. One
Yes.
client actually, instead of getting on your phone and doom scrolling for a break, one of my clients would simply go on one lap around her clinic. And she lives in the Northwest. So she would
Hmm.
get outside. It's beautiful outside. She would invite a colleague with her. So she was getting like max packing this tiny little 5-minute break, getting away from a
Mm.
screen, moving her body, inviting a colleague and socializing and shifting her energy all in 5 minutes. And if she can boost her productivity and her energy for the rest of the afternoon from that tiny little 5 minutes, I think that we might be able to figure out how to make that work in our schedule.
Yes. We're missing out on something, and that's something so beautiful is breathing, pausing, and moving our bodies. I think movement is really underrated. I just like that 5, 10 minute walk after lunch or whatever it is, or just in the morning. Oh, it's so powerful.
And look at nature. I always use this example. Two ducks, they get into a fight, right? So they're
Hmm.
pecking at each other, they're facing
Hmm.
off. If you look at nature, they turn their backs on each other when they're done with their fight,
Yes.
and they literally shake it off.
Hmm.
So when I coach one client who works with inmates and it's very stressful work, and I
Hmm.
say, I wonder what would happen if after each session you would just like shake it off, shake
Hmm.
off that energy and reset for the next one, because that's
Yeah,
really intense work.
it is.
And we forget about moving our bodies. And how does nature take care of those friction moments? And can we learn more from that?
Definitely, there's so much we can learn from nature. Wow, really good points. I'm curious, how has your training as a physician helped you understand and support other high stress professionals in ways a non-clinician might not? And I ask this not to be clinician versus non-clinician coach, but I believe in the world of coaching, anyone can call themselves a coach, unfortunately, but I don't think the outcomes of the same or the training is the same. So I really think it's important to highlight why it is important to work with somebody who has certain skill sets, certain experience, and are still continuing to grow. So, what do you think sets you apart than somebody who says, I do what you do? Because the truth is, Dr. Hurley, there are so many who say, I'm a coach that helps people with healing, I help with burnout.
And I think that there's not one right method of coaching. And
For
so part of
sure.
it is knowing what are you looking for if you know you're
Hmm.
looking for a coach and getting a good match. And what is your coach's experience?
Hmm.
I also think, because I had a conversation with another coach, and she was a former SWAT team law enforcement officer, and she actually got traumatized by working with a non-trauma informed coach.
Uh,
And from my perspective, I can't take my trauma lens off. I'm always looking at behavior
100%.
with a trauma lens. And so one of the my pleas with other coaches is that you need to know your limitations. So as a pediatrician, I needed to know my limits. I wasn't a surgeon, I wasn't a psychiatrist. And when something was outside of my comfort zone, outside of my training, I needed to be good at passing that person to the right person. Same
Yes.
thing with coaching.
Yeah.
And also, if you don't understand about anything about trauma and you are misunderstanding this person's behavior, then you can actually cause more damage than good. And so that's just like, you would want to vet out your physician, your plumber, your,
Hmm.
home remodeler. You should vet your coaches and find out what kind of clients they serve well. And because it's not always a good match. And I know for me, I was asking you to find out more about your kind of coaching because I'm not the right coach for everyone. And I want to know who the other coaches are out there so that if somebody's not a great fit for me, then I know other people I can refer them to. Or sometimes I'm like, you're not ready for this. I think you need to work with your therapist first for a while and then
Yes.
be ready, because at
Hmm.
that time I had just high performance coaching and I didn't
Hmm.
have a softer, more gentle version, which I do now, which helps me help people who are struggling. But sometimes it's yes, and you do the coaching and you need to get some help from a trained psychiatry or psychological professional.
I agree. I like that. Knowing one's boundaries, knowing one's skill set, having integrity and be able to pass that person off to somebody else. And in family practice, even though I see different types of ailments, conditions, etc., there are some patients where their cases are quite complex, and I want to get a second eye, like another opinion, like, okay, what are your thoughts to make sure that we're on the right page? They're like, it's all good, Dr. Mitchell, continue, but I still don't let ego get in the way because at the end of the day, this is somebody's life. This is someone's loved one. This is, like you mentioned, trauma-informed lens. And it's again a term that when I was in training, which wasn't that long ago, though it's getting longer. It's a decade and a half almost. But it's time flies. We never spoke about trauma-informed anything. There was no lens. The only lens we talked about was like the 1 hour of ophthalmology I took in medical school or something, 1 week maybe,
Yeah.
you
Well,
know?
in pediatrics, we spent one day with a child abuse specialist. And I was intrigued at that time, and I created a month rotation with her instead of
Right?
just one day. But everybody else out of 3 years of pediatric training had one day. And the statistics for the number of kids who have had trauma, I mean, we've all had
Look at the
trauma,
ACE
but
scoring
abuse.
now.
Well, and yeah, and that was actually the ACEs. I think that came out around the time I got out of training. You want to know the sad part about ACEs? I did not learn about the ACEs study until I began working at the Child Abuse Center. And I actually worked for Kaiser Permanente, which is where Dr. Filiti, the person who penned
Glad to
that
say.
study, trained with. And I thought, not only does every physician, every
Needs
healthcare
to know about
provider
it.
need to know that study inside and out, and for certain, Kaiser Permanente should be making sure all of their employed healthcare providers know about that study. I was flabbergasted that I had not heard about it until I switched over. And yeah, if you haven't heard the ACEs study, definitely go look it up because it's got so much good information.
It's powerful. It really is. And I
And
learned
there's,
about it in training. I learned about it after on my own journey. I was like,
yeah.
oh my goodness.
And there's many others after it, that show even more powerful data that adverse childhood experiences will have dramatic effects on your mental and physical health as an adult.
Mm-hmm.
Yeah.
Definitely. Definitely. And we're just begun. Like, there's so much for health providers to learn. In the news, they're talking about, all medical schools should have nutrition training, for example. And I'm trying to think what nutrition training do I have? I don't remember a particular course on nutrition. I looked at my old medical school transcripts a few months ago. I was like, where is nutrition? I'm like, I'm not quite seeing that. Did you see it on yours?
I don't think I could find my transcripts, but I remember statistics. I
Yeah,
remember pathology. I do
yeah.
not remember any courses in nutrition. And yet I am excited though. So, we're talking about a lot of negative things about medicine, but more integrative medicine and a
Yes,
holistic medicine.
yes.
And I love how you're introducing some of those voices on your podcast, because we're a holistic being.
We're whole.
And it's not just about medication. It's about, what's the food as medicine and, your sleep and so many other things that we can do for our health.
Yeah,
Um,
100%. I agree. I'm definitely looking at more of a holistic approach, integrative medicine, lifestyle medicine. It puts a smile on my face and it makes things make sense. And when patients hear it, see it, understand it, the joy it brings them, they feel more empowered. But again, it's how you present it, how you connect with them. People can say the exact same thing, it's just the way they say it. And one sticks, one repels. Change is happening. I pray medicine has a complete PR shift because we did what we knew back in the day, right? That was what we knew. But now we know better.
Now we know better.
Right?
Absolutely.
And to say we don't know is ignorance is bliss. That doesn't fly no more. 'Cause I think it's becoming more and more normalized. More and more physicians, healthcare leaders are using their voices, using their credibility, and talking about these things. And more of us are practicing it. You know what I mean? Like, as much as I talk to my patients about healthy lifestyle, I feel like if I don't practice it, I'm the worst hypocrite.
Where's your
right?
integrity? Oh, I
It's like,
remember talking to my business coach a few years ago, and his wife had a baby in the hospital. He's like, I've never seen so many unhealthy doctors in my life as in that hospital. What's
mhm,
wrong with you people? And I
right?
was like, do as I say, not as I do. My hope is that I mean, how painful does it need to get with, the burnout rates, the suicide rates,
Right?
the mental illness rates
Yes,
before we wake up and say, "Oh, this is me. This is my profession we're talking about. We got to
yes,
do something about it."
exactly. So we need to be mindful of that as healers. We need to practice it. You want to the point where your patients, your clients, they see what's in you. They see the joy, the radiance, the vitality, and they're like, "Doc, coach, I put me in. I want what you have." It's easier to convince them when you're already like glowing, when you're already doing the work. Doesn't mean you're perfect. There are things I like. Everyone has their quote unquote weaknesses of food or things that they enjoy, but it's not 90% of my diet. It's like less than 10%. It's a small amount, but it's lived experiences and practicing. I remember a patient told me once that they had a cardiologist who told him he needs to like exercise more, and he was like a fairly fit firefighter. And the cardiologist is like 350 pounds, and he's just like, whatever, bro. Like he just like no in one ear. I'm not saying we're supposed to judge, but it's the reality of life. We
Absolutely.
have to
We
acting
have
like
to role model.
we have to role model it.
Yeah.
So no pressure, but yes, there's pressure. We all have to do better. We should be the healthiest bunch. We really should be. We have so much knowledge and wisdom and access to tools, resources that the average Joe does not have. If we need to get a preventative screening test, we can call up our friend and be like, hey, or get a referral in. We have resources. Like, come on, because the way we show up impacts our patients.
Yeah. And if we put ourselves at the top of our priority
Yeah,
list, everybody wins.
everybody wins,
Yeah, including us. And yet
including
we
us.
so oftentimes are at the bottom. So
Yeah,
yeah, so if this is you, listener, get
yeah,
yourself to that top of the priority list
yeah.
and see what magic happens.
Exactly. I think that's a great place to end our conversation. But I really enjoyed this conversation, Dr. Hurley. To our listeners who are listening to you and be like, I would love to be coached by you. How can they reach you?
You can find me at transformationaldoc.com or erinhurleymd.com. And I'm also on LinkedIn and
Mhm.
Facebook under those two, Erin Hurley MD and Transformational Doc.
Love it, love it. And to our listeners, thank you again for spending your most precious resource with us, and that is your time. I don't take it for granted. We're all busy, but you chose to engage with us and listen and to apply. So thanks again. Feel free to share with your friends and family, as this message is not just for healthcare providers, it's for everybody. We all need to do better. And life can be so amazingly sweet if we practice these basic principles, take time for movement, take time for joy, being intentional, and setting really good boundaries. And it's not fluff, it's real. Anyway, till next time, this is your host, Dr. Tomi Mitchell from the Mental Health and Wellness Show. Bye.